According to the World Health Organization, mental health is a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn well and work well, and contribute to the community. It includes our emotional, psychological, and social well-being, and it affects how we think, feel, act, and make choices, and relate to others. Mental health is a basic human right for all people. Everyone, whoever and wherever they are, has a right to the highest attainable standard of mental health. This includes the right to be protected from mental health risks, the right to be available, accessible, acceptable, and good quality care, and the right to liberty, independence, and inclusion in the community. As mentioned, mental health is a complex continuum, for this is experienced differently from one person to next. It varies for the difficulty and distress in different social and clinical outcomes. What you may experience currently in your mental well-being may be different to others. We all have our own struggles. Every day we fight our own darkness, and it varies per person. Mental health includes disorders and psychosocial disabilities, as well as other mental states associated with significant distress, impairment in functioning, or risk of self-harm. Psychosocial issues are events or disruptions in a person's life, such as housing concerns, financial matters, domestic abuse, grief and loss, isolation, and other factors specifically related to mental health, depression, anxiety, and adjustments. Psychosocial issues can be further defined as conditions or problems in personal, social, occupational, and environmental domain, as well as those related to physical and mental health. A lack of understanding and sensitivity towards psychosocial issues can influence patient responses to interventions. Some of the major psychosocial issues are family problems, depression, anxiety, substance abuse, sexual abuse, and violence. But around the world, the most common psychosocial issue is depression. 1 in every 10 young adult Filipinos suffer from major depressive disorder. According to the World Health Organization, depressive disorder, also known as depression, is a common mental disorder. It involves a depressed mood or loss of pleasure or interest in activities for long periods of time. People suffering from depression usually has their symptoms lasting 2 weeks or sometimes longer than that. You might feel bored or sometimes lost interest in doing the activities or things that you like or love the most. You'll feel a sense of emptiness, like you don't know why you're not enjoying it. It's not like you don't like it, but you feel rather empty inside. People who suffer from depression feel a different kind of sadness. They may struggle opening up or explaining the kind of sadness that they feel. There are some people who suffer from depression who feel and blame themselves for things that are sometimes beyond their control. They feel guilty for things that did not happen, or if it happened, they blame it on themselves. How do we address and approach depression? Learn as much as you can. Try to understand what causes and triggers it. Finding the right treatment takes time. It might take some trial and error to find the treatment and support that works best for you. For example, if you decide to pursue therapy, it may take a few attempts to find a therapist that you really click with. Other treatments, including exercise and therapy, can be just as effective as medication, often even more so, but don't come with unwanted side effects. If you do decide to try medication, remember that medication works best when you make healthy lifestyle changes as well. Get social support. If you are feeling stuck, don't hesitate to talk to trusted family members or friends, or seek out new connections at a depression support group. Asking for help is not a sign of weakness, and it won't mean you're a burden to others. Often, the simple act of talking to someone face-to-face can be an enormous help. Treatment takes time and commitment. All of these depression treatments take time, and sometimes it might feel overwhelming or frustratingly slow. That is normal. Recovery usually has its ups and downs. Other ways and how we can address depression are focusing on self-care. Control stress with activities such as meditation, eat healthy, exercise, and get enough sleep. Most adults need 7 to 9 hours of sleep per night. You can also avoid using alcohol and substance abuse, which can worsen symptoms and make depression harder to treat. Set small and achievable goals. Set realistic goals to build confidence and motivation. Know the warning signs. You can also ask for help and recognize your depression triggers and talk to your doctor or mental health professional if you notice unusual changes in how you feel, think, or act. You can also write down how you feel day by day, your moods, feelings, and reactions to spot patterns and understand your depression triggers. You can also educate your family and friends about major depression. Seek support. Whether you find encouragement from family members or a support group, maintaining relationships with others is important, especially in time of crisis or rough spells. Stick to your treatment plan. Even if you feel better, don't stop going to therapy or taking your medication. Abruptly stopping medication can cause withdrawal symptoms and a return of depression. Participating in self-management education program can help patients manage depression and take control of their symptoms. At the end of the day, we are the ones who's responsible for battling depression. The counseling, therapy, medication, support groups are there to help you. But in the end, we must also help ourselves. It will take time, but eventually we will be okay. Let's talk about suicide. increase happiness, and more. It can help you adapt to changes, build strong relationships, and recover from setbacks because self care is a necessity for everyone. Vomiting, faintness, dizziness, or extreme agitation. Meanwhile, here are some practical assistance we can offer to them. Clarify what they have told you about their needs and concerns. Help them problem solve and develop an action plan for next steps. Teach them some coping skills like deep, slow breaths, write in a journal, be with friends or loved ones, stretch exercises, listen to music, reach out for spiritual support, warm bath or shower, make a list of recovery actions, maintain a healthy routine, you rest, eat well, drink fluids, exercise. and avoid drugs, alcohol, or binge eating. You can also set a small goal for each day related to recovery, actions, and check off lists when done. With all this, the most important aspect one should have and practice to become a psychological first aider is the genuine compassion to help others. Be the helper one is needed. We hope you learned something from this. Let me just leave this quote from Lewis Carroll. One of the deep secrets of life is that all that is really worth doing is what we do for others. Thank you and hope to see you around Fatimania.